Cancer centers across the nation are dealing with shortages of drugs critical to cancer and chemotherapy treatments. A study earlier this month said centers are looking to find alternatives to help patients fight cancer. But how are we faring at home? Christian Garzone spoke with the Wilmot Cancer Institute this afternoon. He joins us now from the studio. Christian.
Yeah, Teresa, in short, we're doing okay compared to other places right now across the U.S., at least right now. Both of these drugs, Carboplatin and cisplatin, are used to help treat cancers like prostate, lung, and breast, as well as leukemias. Right now, Dr. Dan Kieran with Wilmot says in the U.S., there are not as many companies making the products that are needed. Just one factory closing down for any period can be a hit to the system. He says we've had shortages over the past decade, but what makes this concerning is that these drugs are used for so many common cancers. He says the strategy is to find places that have good alternatives, then shift that therapy for patients away from the short supply drugs, reserving them for folks who need them the most.
The biggest challenge is the drug right now called Carboplatin. And the drug called Carboplatin has a substitute called cisplatin. That was the first change that was made across the country, and now the cisplatin supplies are also getting short. I would say we've been selecting therapies on the basis of who does or doesn't have good alternatives. And if people have good alternatives, then we've been offering those. And that has been successful for us in comparison to other institutions.
He said to resolve this, the federal government needs to figure out if they want to import cancer drugs in from other countries or not. Teresa, back to you.
All right, Christian, thank you. Those impacted are also relying on insurance companies to play a role in resolving this problem by agreeing to cover alternatives.